Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. I have great pleasure to chair our students year 1, semester 2, Wydad University College in the online presentation of this very important and critical issue related to COVID-19 infectious disease that can be considered as major public health crisis. The topic will be titled by Fight Against COVID-19. The presentation will be done by selected group of year 1 students, Nur Uyun, Uto, Nur Layani, Sivarani, Rawan, Nur Hazila, and Muhammad Fikri. We hope that this presentation may cover and include different aspects related to COVID-19, epidemiology, risk factors, morphology of the virus, pathogenesis, mode of transmission, symptoms of the disease, possible medications, how to prevent, and finally, conclusion by our students. Now we can start.
Announced it as a pandemic early of March 2020, whereby pandemic means it's a epidemic occurring worldwide and in a large population. Okay, the current Centers for Disease Control and Prevention guidance for clinical care of patients with COVID-19 is basically derived from on March 7, 2020, they have been highlighted that no specific treatment for COVID 19 is available as of now and emphasized that the management should include prompt implementation of recommendation, infection prevention and control measure according to the particular area or region, for example, a country or depends on the state. And also, we come to know remdesivir drug is available to COVID-19 infected patient through enrollment in a clinical trial or application of the emergency access. So, in the United States, there are three ongoing clinical trial, which is basically differentiate by severity of this particular disease. For example, like a moderate and severe infection of the virus, study design, for example, placebo controlled. Okay, next slide. Okay, so moving from overview to next one, which will be a risk factor. This particular risk factor is basically for the patient who have the diabetes mellitus past history, who has been infected coronavirus. Okay, so we come to know according to the epidemiologists and the researchers that patients with a diabetes history are highly at risk, whereby a study from the UK's National Health Service has found that the people with the type 1 diabetes, basically type 1 diabetes, whereby it's an insulin dependent diabetes, are more likely to susceptible to COVID-19 infection as compared to those with the diabetic with the type 2. Type 2 is basically they are does not respond to the insulin. So to continue, almost 1 in 3 people who have died of the coronavirus infection thus far in England's hospital also had a diabetic history. We also come to know those with type 1 were all times more at risk of dying due to the complications of the disease, while type 2 presented twice the risk compared to those without diabetes. So basically, what they conclude is those who are type 1 diabetes have the high risk compared to type 2. And furthermore, SARS-CoV-2 is known to utilize angiotensin converting enzyme 2, basically we known as a ACE2 receptor for entry into the target cell organ. ACE2 is an enzyme which will be attached to the cell membrane for like lung, arteries, and some organs in our body. Okay, next slide. Okay, all right. This particular angiotensin converting enzyme 2, which is known as ACE2, is the surface receptor of the SARS coronavirus, which will be directly interacting with the spike of the glycoprotein, which is in the outer surface of the coronavirus. Okay, and a recent study suggests that the affinity between the ACE2 and the receptor binding domain, which is 10 to 20 times higher than the with the receptor binding domain of COVID, indicating that ACE2 might also be the receptor of this particular SARS-CoV-2. And moreover, ACE2 was reported to be widely expressed in various organ systems, for example, in the cardiovascular system, kidneys, lungs, and brain, which might provide an explanation where there is a justification why patient who have to those who have a COVID-19 patient died with the multiple organ failure. To continue, it also been reported that the plasma glucose level and diabetes are independent predictors for mortality and morbidity in patients with SARS. And to be can be said that patient had a poor glycemic control during hospitalization according to the research in Wuhan. This is more to 90% of the patient who have the past history of diabetes mellitus. Okay, and we also come to know since viral infection may cause sharp fluctuation of blood glucose level of diabetes patient, which adversely affects the recovery of patient. So there is a reason to suspect that diabetes combined with SARS-CoV-2 pneumonia may form a vicious circle, which is detrimental to the prognosis of COVID-19. Okay, next slide. Okay, so these are the potential mechanism that may increase the susceptibility for COVID-19 in patient which having the diabetes mellitus. For example, these are the part of the mechanism which are still in the midst of the research. So the first of all is the higher affinity cellular binding and efficient virus entry to the body, which is the host cell, and also decrease the viral clearance. And thirdly, is a diminished T cell function and increase susceptibility to hyperinflammation and cytokine storm syndrome. And lastly, presence of cardiovascular disease. So, to for this particular cases, risk factor, important clinical conclusions. The example, hospitalization is more common for acute COVID-19 among patients with the diabetes and obesity. Secondly, diabetic medication need to be re-evaluated upon admission because once a patient have a COVID and together with the past history of diabetes, their body will have a high and up of the glycemic level in the body. Thirdly, it will be insulin is the glucose lowering therapy of the choice. Okay, next slide. Okay, so these are the image you can see. Patient who have a COVID infection and also past history of diabetes mellitus, who have diabetes mellitus can be type 1 or type 2, who when they have a well controlled blood glucose level, the survival of this patient is more than 90% compared to the patient who have a poor controlled blood glucose. So it is the risk factor is there for the diabetes patients more. Okay, so this is all for my part. So moving on to the next, which is epidemiology, which will be presented by Liani. Thank you.
Allow microphone to be on. Microphone. Microphone must be on.
Hello?
Yes. Yes. Only one microphone is on for the speaker. Speaker only make microphone on. We can hear. Now we can hear. Can start. Can start. Nurlayani.
Hello?
Yes. Yes. We are hearing. We are hearing.
Sorry for the technical problem. So I will proceed about the epidemiology. I will proceed about epidemiology. Uh, Up until 19 June 2020, WHO has reported that two highest continents, which is America and Europe, has the highest cases globally. With these two countries have different almost 1 million cases, showing that this COVID-19 phase is still in a serious condition.
Please louder. Louder. Higher voice. Higher.
And in America continent, five more highest country recorded are United States of America, Brazil, Peru, Chile, and Mexico. While in our country, Malaysia, stated that total confirmed cases is 8,529, with total confirmed cases is 40, and total death up until 19 June 2020 is 121. I will pass morphology to Otto.
Okay, Assalamualaikum everyone and very good morning. Okay, we're gonna move to morphology of this particular virus. So COVID-19 virus is a single-stranded RNA virus which has crown appearance on its on its envelope, which is called spike glycoprotein or S protein. So it's also known as beta COVID virus, and it's a round or elliptic, or it sometimes can have a polymorphic forms, and its diameter sometimes around 60 nanometer until 140 nanometer. Move next slide please. So for the pathogenesis is basically same as the theoretically for the virus, since the virus will attach to the S2 receptor in the mostly in the lungs, and it will penetrate into the host cell by endocytosis or membrane fusion. So after the penetration, it will make the biosynthesis, which is once the viral content are released inside the host cell, the viral RNA will enter the nucleus for the replication. And after that, the viral mRNA is used to make a viral protein. So for this kind of the biosynthesis, it will make the new viral particle which is in maturation. After the maturation, the the virus will be released, and the viral load the host cells and ready to be released. Sorry. Next slide. So for the mode of transmission, so basically there's four. Firstly is respiratory droplet, which is the particle in the range of 5 until 10 micronanometer in diameter. So second, aerosol transmission, 3 close contact, which is the person who live with COVID-19 patient, and sometimes contaminated object. We can see here plastic, which is the virus can live until 2 until 3 days, stainless steel 2 until 3 days, and cardboard, which is 1 day. And the new research has found basically a week ago in the banknotes, the virus can live around 4 until 5 days, which is that's why we need to wash our hand and keep hygiene in the maximum level. Next slide. So for the incubation period, which is WHO has been announced, is average on 5 until 6 days. However, the virus can be up until 14 days, and during this period, also known as pre-symptomatic period, and some infected person can be contagious. We move to Yani. Thank you.
Basically, proceeding with the symptoms of COVID-19 can be classified based on common, less common, and severe. For common symptoms, usually patient will exhibit symptoms such as fever, dry cough, and tiredness. For less common symptoms, patient will experience sore throat, aches and pain, diarrhea, headache, loss of taste or smell, or maybe loss of both, conjunctivitis, and lastly, rash on the skin or discoloration of fingers or toes that characterized by urticaria, vesicular, livido reticularis, acral ischemia, biliform, and petechial. All these presentation usually will occur at the chest, hand, leg, and toe. And lastly, for the serious symptoms, patient will experience difficulty of breathing or shortness of breath, chest pain or pressure in the chest area, and lastly, loss of speech or movement. Proceeding to the line of treatment that has been introduced since the COVID-19 outbreak, today we will highlight several significant drugs such as remdesivir, favipiravir, where this two drug is currently in active undergoing clinical research. And then we will also discuss about controversial chloroquine and hydrochloroquine, lopinavir, umifenovir, dexamethasone, and anticoagulant. Firstly, I will proceed with the remdesivir. Basically, remdesivir is an antiviral drug introduced by Gilead Science that was developed in 2014 as a possible treatment for Ebola hemorrhagic virus. However, during the clinical research for Ebola, it shows limited effect during clinical trial for Ebola. And remdesivir is an adenosine analog that has been proven to have a broad spectrum activity against single-stranded RNA virus. A study shows that remdesivir able to inhibit replication of other human coronavirus associated with high mobility in tissue cultures, where this study is then being supported by another study by using animal model showing that there is efficacy demonstrated of remdesivir against severe acute respiratory syndrome, coronavirus SARS-CoV in 2003, and remdesivir against Middle East Respiratory Syndrome coronavirus MERS-CoV in 2012. Regarding our current issue, which is COVID-19, National Institute of Health of US has undergone an adaptive randomized trial of Remdesivir. This trial started by involving a passenger of Diamond Princess cruise ship in quarantine at the University of Nebraska Medical Center back in February 2020, where this passenger returning to US from Japan. The clinical trial started by giving out placebo to moderate and severe COVID-19 patients, and then the result being compared with patients who received standard care. Clinical research using remdesivir is then continued by involving almost 1,000 hospitalized patients with advanced COVID-19 and lung involvement. Result of patients receive placebo and patients who receive remdesivir is then being compared, showing that patients who receive remdesivir recovered fast than patients who receive placebo. The result also stated that patients who received remdesivir had 30% faster time to recovery than placebo patients with the p-value less than 0.001, showing that remdesivir might have a significant effect if being used to treat COVID-19. The comparison also results in patients who receive remdesivir will recover from COVID-19 in 11 days rather than patients who receive placebo. It takes up to 15 days to recover from COVID-19. Lastly, another positive result showing that survival benefit by day 14 with a mortality rate of 7.1% in remdesivir compared to 11.9% in placebo patients. Proceeding to mechanism of action, researchers agree that the use of polymerase enzyme extracted from coronavirus, noting that the enzyme can incorporate remdesivir into the synthesizing single-stranded RNA. Remdesivir able to resemble as a RNA building block and becomes a part of the new RNA strand. And then it was noted that in addition of remdesivir, the polymerase enzyme will stop adding more RNA subunits, resulting in stop the genome replication. This mechanism is said that it linked to remdesivir ability to metabolize into an active form known as GS441524, which is an adenosine nucleotide analog. This nucleotide analog will interfere with the actions of viral RNA-dependent RNA polymerase and evade proofreading by viral exoribonuclease, which will decrease viral RNA production. Current research is still ongoing to understand whether the drugs will terminate RNA change or will cause mutation in RNA. Next, Pravi.
Okay, Assalamualaikum and good morning to all the participants who joined this talk. So today I will talk about the drug that has been investigated and under tested to treat the patients with COVID-19 virus. So Favipiravir uh, uh, is usually sold under the brand names such as Avigan, and Fabiflu. And Favipiravir drugs also has an previously name before this, which is T705, which is a prodrug come from the purine nucleotide, which name is Favipiravir ribofuranosyl 5' triphosphate. And so the active agent of these drugs usually inhibits the RNA polymerase, which it can halting the viral replication. And the result shows that the preclinical data that derive from its influenza and Ebola activity shows that the agent also demonstrated broad activity against other RNA viruses. And other tests also has been worked that using the in vitro technique in the Viro E6 cells, that the type of EC50 of favipiravir uh, has been a response that it can effectively fight against the SARS-CoV-2 by using amount of 61.88 micromilliliter amount of drugs. And this treatment of COVID-19 should be considered doses at the higher end of the dosing range, which is we can divide it into two, which is a loading dose and a maintenance dose. And the loading dose is usually recommended about 2,400 milligram to 3,000 milligram every 12 hours, which is they must take two doses every 12 hours. And followed by the maintenance dose, which is they must take 1,200 milligram to 1,800 milligram every 12 hours. However, this agent of this drug has not have a serious effect on the patient because it has only the mild adverse effect, and this drug is overall well tolerated. Okay, next slide. So this drug, the favipiravir, is usually used in Japan for the influenza treatment, and they are also undergoing a test and being studied to use this drug to treat the other viral infections. However, in the US, uh, it is not available for the clinical use, and the specialist and the doctor has comparing between the two drugs for to show that uh, which drug is more effective to treat the COVID-19 virus. They use the favipiravir and arbidol, and they use the same amount of that to show the results. And the result shows that favipiravir has a higher clinical recovery, which the results get 71.4% more than arbidol, which is 55.9%. And this shows that favipiravir has a higher efficacy in treatment of COVID-19 virus. However, this review of proposed drug is by necessity selective, which it has not been used to all patients and only the selected patients only. Okay, thank you. Move on to Hazila.
So now we will talk about the controversial drug, which is chloroquine and hydroxychloroquine. Both chloroquine and hydroxychloroquine are anti-malaria drugs, but they were reported that they efficiently inhibited SARS-CoV-2 infection in vitro. Hydroxychloroquine is chloroquine derivative, which has less toxicity, fewer concerns about drug-drug interactions, and may be more potent to treat COVID-19. So these are possible antiviral mechanisms of chloroquine and hydroxychloroquine that have been observed in vitro. One, chloroquine or hydroxychloroquine inhibits terminal glycosylation of angiotensin-converting enzyme 2 receptor, which is target of SARS-CoV-2 for cell entry. 2. Chloroquine and hydroxychloroquine suppress quinol reductase 2 activity to inhibit biosynthesis of salicylic acid, which can affect S2 receptor activity to prevent proper binding of virus to receptor. 3. Chloroquine and hydroxychloroquine have peak-based properties, and when enter endosome, endosomal enzyme pH will increase and inhibit endocytosis process that can interfere with virus entry or exit from host cell. 4. Chloroquine or hydroxychloroquine will interfere with uncoating process of the virus to inhibit release of viral genome inside the host cell. 5. Within trans-Golgi network, chloroquine and hydroxychloroquine interferes with assembly and binding process and lead to accumulation of viral vesicles and prevent the release of virus. 6. Chloroquine and hydroxychloroquine alkalize lysosomal enzyme to prevent fusion of lysosome with autophagosome and interfere the degradation process of lysosomal protein inside the cytoplasm. Next slide. So, I'm sure most of us already hear about chloroquine and hydroxychloroquine. Many countries also have used chloroquine and hydroxychloroquine as treatment for COVID-19, such as America, Malaysia, Europe countries, and others. So, hydroxychloroquine is one of the most popular possible treatment for COVID-19 drug, and many controversial issues had circulating around it. So here is the timeline and summarized controversy of hydroxychloroquine. So on February 17, 2020, the State Council of China held a news conference indicating chloroquine demonstrated efficacy in treating COVID-19 associated pneumonia. On March 28, FDA granted emergency use authorization for hydroxychloroquine to be used for certain cases. On April 6, Trump touts hydroxychloroquine as a cure for COVID-19 and called it as a game changer, despite limited research whether it is effective against virus have gained public interest. On April 24, FDA issued warning about usage of hydroxychloroquine outside study setting. On May 25, WHO temporarily suspended clinical trials of hydroxychloroquine after publication of study in the Lancet in May 2022, which indicate that hydroxychloroquine increased chances heart rhythm abnormalities and chances of dying. On June 3rd, WHO resumed study of hydroxychloroquine after review the data concerning heart risk found no reason to modify the study. And June 15, FDA rescinded its EUA of hydroxychloroquine to treat COVID-19 patients, citing concern about efficacy and risk of the drug. And on June 17, the WHO drops hydroxychloroquine from COVID-19 clinical trial. So here are some unfavorable and serious side effects of chloroquine or hydroxychloroquine in various systems. So in cardiovascular, it can lead to ventricular arrhythmia and lead to ventricular fibrillation. Some rare disease is cardiotoxicity. In neurology, convulsion, headache, dizziness, tinnitus, vertigo, and personality change and depression may occur. In liver, abnormal liver function and fulminant hepatic failure. In gastrointestinal system, patient may loss of appetite, diarrhea, nausea, vomit, and stomach cramp. In ocular, the most common is retinopathy, and in cutaneous, non-light sensitive psoriasis, alopecia, skin and mucosal pigmentation due to allergy. So, in a study conducted, the results showed that azithromycin added to hydroxychloroquine was significantly more efficient for virus elimination. In the study, the dosage used is 500 mg of azithromycin in day 1, followed by 250 mg per day in the next 4 days taken with hydroxychloroquine. The results show in this graph, and you can see that percentage of COVID-19 patients treated with hydroxychloroquine and azithromycin combination is drastically dropped to 0% from inclusion to day 6. Percentage of patients that treat with hydroxychloroquine only dropped to around 40 to 50% in day 6, and percentage of control patients that did not treated by any of the drugs remain high in day 6. However, on May 2020, the WHO database shows serious heart impact of hydroxychloroquine and azithromycin, and their combination yielded an even stronger signal of cardiovascular adverse effect, such as later acute cardiac pro-arrhythmogenic effect. That's all from me.
Okay, so next we're gonna move to lopinavir. Lopinavir is an antiretroviral drug, which is a protein inhibitor and is widely used for treatment of HIV and is a potential candidate for the treatment of COVID-19. So as we all know, the SARS-CoV-2 viruses into the host cell and replicate, producing strands that contain multiple copies of the viral genetic material, which is RNA. So this virus has an enzyme, which is a 3-chymotrypsin-like protease, which plays a role in processing the viral RNA. As lopinavir is a protease inhibitor, it may inhibit the action of 3CL, thereby it will disrupt the process of viral replication and release from host cell. However, coronavirus proteases, including 3CL-Pro that we discussed earlier, do not contain a C2 symmetric pocket, which is the target of HIV protease inhibitors, leading some to question the potential potency of HIV protease inhibitors in treating these viruses. So as you can see here, this is lopinavir. It inhibits the 3CL proteases so that the virus cannot replicate. So as many other drugs, lopinavir also has its own side effects, including the heart rhythm problems, severe allergic reaction, liver problems, and inflammation of the pancreas. And to conclude, as for now, results in several clinical trials show that there is no benefit observed from treatment of lopinavir beyond standard care. Next, we move to umifenavir. Umifenavir, which is also known as arbidol, is an antiviral agent with a unique mechanism of action. Umifenavir is a hemagglutinin inhibitor, which can specifically inhibit fusion of the virus with the host cell membrane and inhibit the synthesis of viral DNA, also RNA viruses. It can also induce the production of interferon and play a role in regulation of the immune system. If we combine with drugs, umifenavir with drugs that have different antiviral mechanism, umifenavir may show an improved efficacy, but as a trade-off, the potential adverse effects may increase during treatment. Also, a study found umifenavir combined with lopinavir had an apparent clinical response compared with lopinavir alone. So in this figure here, as you can see, the arbidol one, which is umifenavir, inhibit the fusion of the virus and the host cell. So side effects of umifenavir. Umifenavir is actually tolerable compared to other drugs. During treatment period, patients might experience some digestive symptoms, including diarrhea and nausea, but no severe impairment of liver function and kidney function was found. So here we want to show the recommended dose for lopinavir. The recommended dose is 200 milligram or 50 milligram every 12 hours oral. For interferon beta 1, 200 microgram, which is 1 vial every 48 hours. For remdesivir, the recommended dose is 200 milligram by IV for day 1. For maintenance, 100 milligram every 24 hours for day 2 up until day 10. For hydroxychloroquine, the dose is 400 milligram every 12 hours for day 1, and maintenance 200 milligram every 12 hours for day 2 up until day 14. Next, we're going to discuss dexamethasone, which is a steroid, a medicine that reduces inflammation by mimicking anti-inflammatory hormones produced by the body. So dexamethasone works by lessening down the body's immune system. As we all know, coronavirus infection will trigger inflammation as the body tries to fight it off. But sometimes the immune system works too hard and our immune system could attack our own cells. So with dexamethasone, it will calm the effect. However, it's only suitable for people who are already in hospital and receiving oxygen or mechanical ventilation, which is the most unwell patients. The drug does not work on people with milder symptoms because suppressing their immune system at this point will not be helpful. According to the scientists who carried out the trial, 1 in 3 deaths could be prevented among patients on ventilator. For patients on oxygen, it could prevent 1 death in 5. But there was no significant benefit for patients who were not receiving respiratory support. and the result come from the recovery randomized evaluation of COVID-19 therapy trial conducted by University of Oxford. Here we can see side effects of dexamethasone. Prolonged use of dexamethasone can depress the ability of body's adrenal glands to produce corticosteroids. Abruptly stopping dexamethasone in these individuals can cause symptoms of corticosteroid insufficiency with accompanying nausea, vomiting, and even shock. Therefore, withdrawal of dexamethasone usually is accomplished by gradually reducing the dose. Gradually tapering dexamethasone not only minimizes the symptoms of corticosteroid insufficiency but also reduces the risk of an abrupt flare of the disease under treatment. Okay, so use of dexamethasone in pregnant women has not been adequately studied. When corticosteroids are given systemically, whether orally, intramuscularly, or intravenously to pregnant animals, fetal abnormalities occurred. Also, dexamethasone has not been adequately evaluated in nursing mothers. Corticosteroids appear in breast milk and may cause side effects in infants. Other than that, common side effects of dexamethasone used for non-COVID conditions include anxiety, difficulty sleeping, weight gain, and fluid retention. Rarer side effects include eye disorders, blurred vision, and hemorrhage. However, coronavirus patients only need a relatively low dose of dexamethasone, which should limit the side effects. The chief medical officer for England said there were no excess harm identified in using this dose of dexamethasone in this patient population. That's all from me. We may proceed to next presenters.
Assalamualaikum, my name is Rawan. I will present the last drug in treatment, which is anticoagulants. Apparently, there is no relationship clear between anticoagulants and viral infection like coronavirus, but surprisingly, it was found that there is a strong relationship or association between coagulopathy and death from coronavirus. First, autopsies from victims of COVID-19 revealed development of pulmonary embolism, which was the main cause of death. Second, infection with coronavirus has been associated with increase in fibrin degradation products, fibrinogen, and D-dimers. In fact, these markers have been associated with poor clinical outcomes. Here we'll summarize the mechanisms of development of thrombosis in case of COVID-19. Risk factors include acute illness, dehydrostasis, genetic, fever, diarrhea which lead to dehydration, sepsis, liver injury, chronic kidney disease, COPD, heart failure, and malignancy. All these factors relate to inflammatory response and endothelial dysfunction. Secondary to lymphonemia and inflammatory cytokines increase in lymphokine 6 and CRP. And hemostatic abnormalities will include pulmonary microthrombi, intravenous coagulopathy, myocardial injury, and increased cardiac biomarkers like D-dimers, FBDs, and BT, and increase or decrease or increase platelets. All these factors will lead to one of the three fatal outcomes, like venous thromboembolism and myocardial infarction and association intravascular coagulopathy. And for anticoagulant drugs, we have heparin and ixoheparin, which reduce and prevent blood clots. What's heparin? Heparin is anticoagulant blood thinner. It prevents and prevention of blood clots. Heparin used in treatment and preventing blood clots in veins, arteries, or lungs. And here, one of the well-known non-anticoagulant properties of heparin is anti-inflammatory function. Another concept is antiviral role of heparin, which has been studied as experimental models. The polyionic nature of heparin allows it to bind to several proteins and that act as effective inhibitor of viral attachment. And why Why heparin is indicated in patients in COVID-19? As we discussed, the heparin have properties as anticoagulants, anti-inflammatory, and antiviral. Other oral anticoagulants may be used as aspirin, low-dose, factor X inhibitors. Oral factor X inhibitors include rivaroxaban, evaxaban, represent a new class of oral anticoagulants drugs that require no monitoring, along with oral direct thrombin inhibitors. These drugs are having a major impact on antithrombin pharmacotherapy. And that's all for anticoagulants. Thank you.
Okay, so now we move on to the COVID-19 diagnosis. So the person must be infected by the COVID-19 disease to show the symptoms. So as been explained by Liani before, the symptoms that shows from the coronavirus is such as fever, dry cough, and tiredness. And it also has a serious problems such as you can also experience the difficulty of breathing, chest pain or pressure, and loss of speech or movement, or maybe both of them. And the person who have been infected maybe can contact the doctor if they have been exposed to the COVID-19 virus, and they can tell to the doctor. And if they have been traveled to any areas and or community which has the high risk of COVID-19 disease, according to CDC and WHO. And it is also use some factors to decide whether to test you for the virus that cause COVID-19. It depends on where you live and has a different method. And for example, I take it in the US, the doctor will determine whether to conduct tests that causes from COVID-19 based on the signs and symptoms, as well as if the person had close contact with someone diagnosed with COVID-19. So as we know, to test for the COVID-19 virus, a healthcare provider uses a long swab to take sample from the nose or throat, as we seen on the internet and or TV. And the samples will be sent to the lab for testing. And it also same goes to the person who coughing up the saliva from their mouth. Okay, next slide. Okay, for the diagnosis, the specialist has been used the reverse transcriptase polymerase chain reaction, or RT-PCR, which is it is a diagnostic test that uses nasal swab, tracheal aspirate or bronchoalveolar lavage or BAL specimens. However, the primary method of this diagnosis is the sample will be collected from the upper respiratory samples via nasopharyngeal, which is the samples is taken from the nose, and oropharyngeal swabs, which is the sample will be taken from the throat of the mouth. And the SARS-CoV-2 RNA has been extracted from the upper and lower respiratory tract specimens, and the virus has been isolated in a cell culture of upper respiratory tract secretions and BAL specimens. However, the RNA sample collected from the lower and upper respiratory tract are still limited and not fully studied yet. And the most common laboratory abnormalities reported on the among the hospitalized patients with pneumonia, which is included the leukopenia, which is 9 until 35%, or leukocytosis, which is around 24 until 30%. And also it includes the lymphopenia, which is 63%, and elevated levels of alanine aminotransferase and aspartate aminotransferase, which is around the 37%. Okay, next slide. Okay, from the fact and the study that I found, a radiologist from the Thomas Jefferson University, Paras Lakani, found that individual with the COVID-19 disease usually has white patches on their lungs through the CT scan. which is known as the glass ground, um, which it is known as the defect in the heart of a patient with the COVID-19 disease. Uh, as they are studying, they found that typically patients with COVID-19 has the dead patches on the peripheral and lower lobes and bilateral multiple lobular and subsegmental areas of consolidation of the heart, especially on the patients who have been placed in the ICU. And other than the CT scan findings, they are also using the ultrasound. They can monitoring the progression of the disease through the detection of interstitial lung disease features, such as on the B lines and subpleural consolidations. And both of them have their own advantage in diagnosis the COVID-19 virus in the lungs, which shows that the CT seems to be more precise in detecting apical intraparenchymal lesions. Results ultrasound can identify the smallest subpleural lesions and pleural effusions. However, the radiologists and the specialists around the world um, remains unknown and uh, don't know which is the best radiological strategy to treat the patients. However, um, not all patients must to detected using the CT scan as it costs expensive money and takes a long time, especially as the management and therapeutic approach will not depend substantially on the results. Okay, that's for my part. Thank you.
To continue to prevention, until now there is no specific measure against COVID-19, so all we have to do is the general measures. Okay, the most effective prevention measure include first, maintaining physical distance, a minimum 4 meters from individual, performing hand hygiene frequently with alcohol baths, hand probe if available, avoid touching eyes, nose, and mouth, practicing respiratory hygiene by coughing or sneeze into bent elbow or tissue and then immediately despite the tissue. And then wearing a medical mask if have respiratory symptoms and performing hand hygiene after disposing of the mask, routine cleaning and disinfection of environment and after frequently touched surfaces. In a secure setting, the main infection prevention and control strategy to prevent or limit COVID-19 transmission include the following. First, ensuring triage and early recognition and source control isolate suspected and confirmed cases. Second, applying standard precautions for all patient contacts, including hand hygiene. Next. And then for suspected and confirmed cases of COVID-19, apply the rule of droplets and airborne infection precautions and implying administrative control like MCO. Finally, vitamin supplements, for example, vitamin C, may have a big role to improve immune function. In conclusion, pandemic event of COVID-19 has symbolized a major global public health crisis of our generation. This enormous volume of clinical trials launched to investigate potential therapies for COVID-19 emphasize forces in need and capability to produce high-quality evidence even in the current situation. However, no one therapy have shown any specific effect against COVID-19. So the general measures are the only available treatment till now, awaiting for development of effective specific antiviral and vaccine as well. And that's all, and thank you for listening.
Thank you for all of you. Now, if there is any comment from any attendant, our colleagues, or students? Any comment? Any addition? Dato, Prof. Khalid, Dr. Prof. Abdul Salam. Any comment from any of you? We will happy for any comment, whether criticism or encouragement of our students. They are only year one. Prof. Salam. Just allow the microphone. Prof. Salam, allow the microphone to be on. That's Prof. Khalid.
Yeah.
All
Good
need
morning.
your support.
Yeah. Good morning to all of you. Can you hear me?
Yes, very good hearing. Yes.
Right. Okay. Thank
Yes.
you very much. I'm very impressed with the presentation. I wish to congratulate to you and also to all the students you won. I think really your presentation is really up to the standard, and not much comment I can tell you, except maybe you have a little clinical exposure, especially knowledge about using dexamethasone in pregnant women. In pregnant women, we use dexamethasone quite frequent, especially for premature labor, premature contraction, and also treating the patient that we anticipate going to deliver before term. So dexamethasone is nothing unusual to us. I think when you come to the clinical year, you will know more usage of dexamethasone in the clinical practice. Otherwise, I think a lot of information that I learned from you, especially using all these antiviral drugs and also the use of heparin for treatment in COVID. I learned something also from you today. And that's all. I think I wish you to congratulate to you and also to the student for a good presentation. Thank you.
Thank you, Dato, Prof, for this high support. We are appreciating. Thus, regarding corticosteroids, lactating mothers only for long duration may affect growth and development of the baby only if it is high doses and for long duration, but otherwise no great effect or no great impact, as our Prof speak about. Prof Abdul Salam. Prof Salam. Any comment? Our students. Prof Salam, you can allow your microphone to be on and your feedback. Prof Tuzar, so we need your comment. Just allow microphone to be on. Prof Tuzar, allow the microphone to be on. Still, your microphone is off. We cannot hear you. Yes, Prof Tuzar.
Okay.
We are hearing. Yes.
Morning time. Okay, good morning. First of all, I want to congratulate all of year one students. Even though you are year one medical student, the first year medical student, this presentation show you how you well cooperated, and then you have a well advanced knowledge about COVID-19. That's why, first of all, I would like to congratulate all of you, the students first, and then second thing is the organizers. Thank you very much. And I think this presentation covered all aspects of COVID-19, the current situation. So etiology, pathogenesis, diagnosis, the drug trials, and then prevention aspect. I have some, not comment, but I have some advice regarding with the
drug trials, for example, like remdesivir, and then chloroquine, the drug trial. The speaker has already explained about all the current situation or current updates of remdesivir and the chloroquine. You should when you explain it on the slide, on your slide, you should add the reference detail. Uh, referencing at the end, I saw the last slide is the reference there. But when you are talking about this the data, you should add the reference at the bottom of the slide. For example, like who are the authors, the date of publication, and then so that if somebody wants to, refer, that is an easy way to get this reference. This is one advice. So another one is a diagnostic aspect, because I am also a microbiologist. For the laboratory diagnostic aspect, the Fikri is a good speaker, and he touched on the diagnostic of COVID-19 by RT-PCR. This is now we are currently using. It's a confirmation, the most specific test. And then you should also add some rapid antigen tests. Now, there are some developing, some countries are developing rapid antigen testing as well. So that one you should include. So the last one, the topic, I think that Fikri also mentioned about the cytokines, cytokines in COVID-19, that because of cytokine production very much increased, sometimes it caused the disease. So now the research, the clinicians also noticed that there is a COVID-19 disease, the COVID-19 disease in children, associated with what is called, it is due to cytokine storm, cytokine storm, it is the Kawasaki-like disease, So this is now the current new update, the disease condition in children. So just advice that should add some more information. Not very important one because I need to comment something. So I just give you the advice. Overall, you have well done, excellent speakers, and then cover all the topics. I very much congratulate all of year one students having this kind of presentation, even though you are year one medical student. Thank you very much. That's
Many
all.
thanks, Prof. Tuzar, for these golden comments and advice, especially related to putting the reference sometimes beside the new knowledge or new information. Very important nowadays to be sure that is reference is a good one or not reliable like this. Also, this reflects the big effort by Prof. Tuzar and Dr. Al-Amin in microbiology. Now you are speaking about this virus in details. This reflect good and effective effort done by our professors, Prof. Tuzar and Dr. Al-Amin, regarding virology, immunology like this. Any comment from our lecturers, from our professors? Any comment? Our students also can comment. Our students, your feedback.
Hello, Doctor.
Yes, yes.
I would like to ask, just now there's a presenter mentioning about for COVID patients, upon the radiology, there will be like a consolidation of lungs, isn't it? So if the patients, for example, are having a pneumonia, came with a pneumonia, So are we immediately going to do a swab test because the symptoms is similar, or we are going to treat the patient as a pneumonia first? Thank you.
Yes, thank you. Thank you. Any other comment from our students? Now, at the end of this online scientific meeting, I would like to thank and acknowledge all participants, our respected colleagues, lecturer, professors, and all our students who suffer a lot to will present to present this critical issue. Finally, all of us must pray for Allah for easy prevention of this disease, and very need to have well-proven medicine based on tight clinical trial. And also, we ask Allah for available vaccine for excellent prevention of this crisis, public health crisis. Dato, Prof. Khalid wanted to say something?
Yeah, that's right. Regarding a question asked by a student just now, COVID, they may present in so many ways. One is just having like upper respiratory infection only. They will present as upper respiratory with pneumonia, or they will present as a very bad pneumonia, very bad one. So patient with the early respiratory infection, if you suspect COVID, you can do a test, PCR. Normally you come back after 3 days. And we take a specific precaution. We call it specific precaution. Put patient under PUI, a patient under investigation. So all the necessary should be taken to make sure that the transmission to other people is minimized. Number two, if a patient come to hospital in the pneumonia condition, fever with pneumonia, we can't wait for PCR test to come back because it take about 3 days. So if we suspect pneumonia or worse than pneumonia, we will do a CT scan straight away, CT scan on the chest. Look for typical appearance of COVID lung changes. If a CT scan come back as a typical appearance of COVID lung changes, we treat patient as COVID-19. We send the patient to the COVID hospital immediately. But most of the time, more than 99.9% the result come back positive COVID. So CT scan will give a better result rather than PCR in a worse situation. So in this condition, the clinical diagnosis or clinical assessment is very important. If they belong to just fever, they belong to pneumonia, or they belong to very bad pneumonia. So these features will make a doctor decide how far they have to do a CT scan alone, earlier or later. Okay? Thank you.
Yes, thank you. Thank you, Dato, Prof. Any other comment by any? Again, many thanks for all of you. May Allah support all of you. Many thanks for all of you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Waalaikumsalam. Thank you, Doctor, and all.
Okay, thank you, Doctor.
Yes.
Thank you, Doctor.